My name's Les. I'm from North Carolina in the States. And where I ended up coming over here was basically, this would be my 8th major surgery in about 8 years. And I was having a battle with the insurance company, and I had fallen and knocked my replacement knee loose, and it needed to be replaced. And the insurance company, wanted to replace just a part and not the whole thing. And I said, no, enough, major surgeries is enough, coupled along with 4 minor ones also. So anyway, I was looking for alternative surgeries, and so I spent about 10 weeks looking at different things, some research, some were experimental. And when I came down to it, I finally eliminated the things in, say, Central America and Brazil and some other Philippines and other places in the world. I came down to Bangkok, Singapore, and India. And then I started really digging deep. And when I came down to the point of looking at the infection rate and success rate and look what was going on, it was pretty much hands down for India. The success rate was in the 99th percentile. And the infection rate, less than 1%. I couldn't find that anywhere else in the world. And so I called 4 different of the medical tourism, or I like to call them medical travel, service providers. A couple of them were real rude. They no longer, were in consideration, and I got through with a couple of others. And I ended up, and it's a long story, with IndUShealth because of the nice courtesies there were. They seemed to truly care about what I was doing. The fact that I was in a battle with the insurance company and heaven knows how many months or even years that was going to take didn't seem to bother them. They were concerned about things. And once my hip went out, since it was covered by insurance, it was even recommended I go ahead and have that done in the States, and I did. The amazing thing was that the prosthetic that needed to replace my replacement, called a revision, is made in the United States, but the FDA wouldn't allow it at the time. A few months ago, they finally approved it to be done there. And I started looking around, and so I finally decided, and I came on over. And I haven't been disappointed at all. I've been in the hospital a number of times that make me sort of a semi-expert on some of the things that go on. But here's a cultural thing. The care is not a job. It seems to come, the compassion and the empathy just comes out of the nursing staff. The medical staff works in teams, and everything else does. They come in the room and check in empty trash cans 4 times a day. They come in, one person comes in the bathroom every morning. They clean the bathroom thoroughly, spray it down. Then the second person comes in there and takes care of the floor and squeegees it. It comes to, well, you take one thing, for example, I timed them one time. It takes less than 3 minutes for them to change the bed totally. They have a good attitude, the place is clean. I notice when the food comes from the food services that a lot of the plates are individually saran wrapped, not just covered up. It seems like there's a whole systemic process that goes on that keeps the infection rate down. The infection rate is very important to me. I've had friends that have gotten the staph infection and really almost died from it. I've had one knee that did get infected one time, and it's no fun. So that was a key thing with me. I feel like I'm really cared for, and they really do care about how my outcome is. Other challenges that have come about, being away from home as long as I have been taken care of, which other hospitals wouldn't even deal with. And so I would highly recommend it. And the apprehension you have about going halfway around the world or 2/3 of the way around the world to have major surgery is there. But when you get here and you finish, you think, why did I ever have that? It's just, it's something you got to experience. So I am quite pleased. Hope I don't need any more surgeries. I think I've had my share, more than enough. But if I have to, I'm coming back. When I was in ICU after coming out, I noticed that each bed, there was 4 or 5, a medical team with a couple of doctors and other specialists involved, that they would stay at the foot of the bed and they'd talk about this. Then they'd move on, and they'd sometimes spend 15, 20 minutes. They do what they have to do. It is truly an integrated group. We have I mean, I have an internist. I have one person, a doctor, who is coordinator of orthopedics. We have, of course, Dr. Pai, who is just superb on what he does. And he comes in and he's sharing this information with other doctors. And other doctors are sharing it with him. The PT people in. And they bring in other PT people to, to look and all. For example, in physical therapy, the last 3-4 days, we found a few idiosyncrasies with the therapy I was going through. We modified and changed it. And it's because different people came in, I mentioned something, they had different experiences. It's like in education, cooperative learning groups. You put people together and their differences become their strengths. They bring a strength, they bring something different to the group, which makes it stronger. Everything here, even the cleaning, it's amazing how they come in and every day it's vacuuming and clean up. It seems like everybody is in at least a team of 2. And things are done, and that explains a lot why I think the infection rate is way down. I had a couple of bad teeth that were going to have to be capped to make sure in the future we didn't have infections. At one point they wanted to cap 4 teeth. Just offhanded, I asked about this. I can get 24 teeth capped for $100 more than 4 teeth in the States. I'm having them done here, and I'm just about finished, and I'm quite pleased, quite pleased. In fact, the pain level of doing all of it is quite low. Even she gave me 2 shots in the gum this morning, and I was waiting for her to do it. I didn't even realize she'd done it. The dentist is very well educated. She's got a lot on the ball. She's well trained. She was trained in the States, like every one of the doctors I know of have been actually trained and certified in the States. The dentist here, I've sat there and I've watched her and I've watched her in the mirror. I mean, it's as professional and as good a care as I've ever had. And I've got an excellent dentist back in the States. But the cost that dentists have, and they don't work with you financially like the doctors do, but the cost, just when you're having to pay it out of your pocket, it just got to the point of being prohibitive with me. So I have no qualms about it. My experience has been nothing but pleasant. The outlook has been great. The bedside manners has been beyond expectation, and the medical care I've got was just tremendous.